There we go. We're live. Hello, everyone. Happy
Yay!
Tuesday. Hi, Dr. Rob. Welcome. Welcome to the Feed Real Institute live series. How are you?
I'm great, Ruby. Thanks so much for having me here. I've heard such great things about your Feed Real Institute. I'm excited.
Thank you. Yes, I'm excited too. As I said earlier, we were chatting, we've run around the same circles for quite a bit, but I've not yet had the pleasure to meet you in person or even have a live with you. So I'm very,
Yeah,
very happy that you're here joining us today.
absolutely.
If you guys don't know Dr. Rob already, I'd like to do a quick introduction for you. Dr. Robert Silver is an integrative veterinarian with over 40 years of experience, known for pioneering holistic approaches in pet care, including homemade diets, leaky gut treatment, and alternative cancer therapies. As Chief Veterinary Officer at Real Mushrooms and a published author and formulator, he blends science with nature to support pet health. In his latest book, There's a Mushroom for That. I got it right here. Explores practical uses of mushrooms, cannabis diet, and herbs for common canine conditions. Exciting book. I
It is.
love the cover of this as well.
Yeah,
Super
that's
cute.
I had that commissioned by an artist, and I just love it. We're making T-shirts with it now. It's such a lovely
It's very
image.
cool. I mean,
Mhm.
it includes all the things that we love. We often say in our circle, one of our taglines is that dogs are the bridge between nature and humanity, and I think that rings true. And this
It, it,
illustration is
it
for
really
me
does.
a huge
Yeah,
representation of that.
yeah. This artist in particular has a real love affair with butterflies, so that's why we get to see the butterflies in there too. And I think it's kind of whimsical. I really sort of like the energy of it. The feeling of that painting.
Yeah, no, it's beautiful. If you guys have joined our lives before, you know that we typically chit chat for about 30 minutes and then open up the floor for a Q&A for Dr. Rob. We did get some questions in from Instagram already that I am going to pull up as we go through the conversation. So feel free, if you're here, to drop a comment. We don't have to wait for the Q&A at the end. We can totally pull up your question as we're going, as long as it pertains to our conversation. So before we dive in, we're talking about allergies, cancers, and potentially there is a mushroom for all of that. But can you share, like, what's your background? Give us a little details of your story.
Well, I'm a 1982 graduate of Colorado State University's College of Veterinary Medicine. So I am an OG. I've been around a while. And after I was, and when I graduated from college, I thought that from vet school, I thought I had learned everything I needed to do battle with the diseases of the world, of the pet world. But after a few years in practice, I found that there are a number of conditions, particularly chronic conditions like diabetes, like cancer, like Cushing's disease, like allergies, now like anxiety, and there's so many of them that really the pharmaceuticals and the diets and the approaches of conventional medicine just didn't work well enough. So I started searching for other solutions. And really, it's been, I'm still searching for solutions. But, I found that diet was the first thing I did to change. I started in 82 with a book from Dr. Pitcairn. And I had a lot of clients that were just begging me to do holistic medicine. And so I started offering them diets based on what I was reading in that book, which basically these days with what we prefer for nutrient profiles, they were really high in carbohydrates, but at the same time they worked. Some of the conditions that we weren't seeing response for with conventional medications, just by changing the diet, we got to see some improvement. So that really, that was very encouraging. That got me going. After that, I then joined. I was in the Pikes Peak region at that time, and I joined the Pikes Peak Botanical Association and learned. We started doing herb walks, and I learned how to identify herbs and learned how to collect them and make medicines out of them, and just kept growing and growing from there. Got my acupuncture certification in '93 and learned how to formulate Chinese herbs, and from there, I really got into the formulation thing with with herbs and with nutrients, and then started working for this company, RX Vitamins, creating products for veterinarians that were nutraceutical products. But I had to start teaching veterinarians about the science that underlay these products in order to sell them, because veterinarians are very evidence-based and kind of a little bit tight sphincter and a little bit, a little bit straight-laced. So I had to present it to them that way, and it really seemed to help. Many of those products are still in use by veterinarians, even though I've left the company. And many veterinarians come up to me later and say, listening to you really changed my life in terms of introducing me to holistic modalities. And then after I left RX Vitamins, because mushrooms are having their moment, I joined Real Mushrooms, which is, in my opinion, probably the global leader in the world of medicinal mushrooms, and offered to create a pet line for them. And so 3-4 years later, that's what I'm doing. And of course, very strong component of education, because mushrooms, as much as simple as it seems simple that we can eat them every day and see them in the grocery store, there really are some mysteries to mushrooms that I felt need to be revealed through education, which can help the pet parent to better know how to use mushrooms and other therapies to improve the health of their pets. So that's my story, and I'm sticking to it.
Hence the book in the final step.
Well, the book started. I wrote a book before this called Medical Marijuana and Your Pet, because I'd taken quite a lead in the use of cannabis, veterinary cannabis, and I'd published several chapters in veterinary textbooks and a peer-reviewed paper on that topic. So I'm quite expert in that area, and so so that really was the first book. And then there had been many studies. I published that in 2015, and by 2018 or 2019, there were a lot more studies that really I needed to upgrade the book. But as I was upgrading the book, the mushroom moment overtook me. So the book really contains information both about cannabis, about mushrooms, about herbs, and about diet as well, and specifically how they pertain to 7 different common conditions we see in pets, like allergies, arthritis, anxiety, cancer, bowel disease, epilepsy, and then wellness, of course.
Sure. Well, so why do you think mushrooms are having their moment in pet wellness?
Well, a number of reasons. One, we now have products that contain mushrooms in them, which are easy to give to the pets. That helps, because people aren't going to take the dried mushrooms, the oyster mushroom, and grind it up and do all the things we need to process it to make it better absorbed. So the products were available. Plus, I think with the pandemic, a lot of people were looking for solutions to improve their immune system, either with or without vaccinations, to help prevent what potentially could be a fatal disease. And at the same time, during the pandemic, we have all these pandemic puppies. And so people started looking at their pets as well as being potential recipients for the benefits that mushrooms can provide. So I think those were things. There was a Netflix special, Fantastic Fungi, which I think was viewed widely. Paul Stamets, who's been very strong in promoting the use of mushrooms, he's an iconic person. He's done TED Talks and things like that. So I think a lot of people have been influenced by those things as well, and that's why we now have a mushroom moment.
Sure. How do you feel your colleagues, veterinary practitioners, are, I'd say, on the conventional side, who are maybe on the fence or transitioning into more an integrative approach? How are they receiving using something as natural as mushrooms in their practice?
Well, you have to remember that most veterinarians in practice, the first time they are exposed to a dog on mushrooms is when the dog comes in barfing its brains out because after some rain, it ate some white mushrooms in the backyard. So most veterinarians, the first thing when they think about a mushroom, they think about it being toxic. So that's a very big bar that we have to cross in order to convince them that there's only 1% of all mushrooms globally are toxic. Of course, and you can, of course, if you if you eat one of those 1%, it's a big deal. So, so I've been very strong on education. I've been speaking widely at veterinary conferences. I've been writing papers. I've been contributing, to whatever I can in terms of educating the veterinary population. Right now, my target really is on creating evidence that the veterinarians will see as supportive for their use of mushrooms. And so we're in that process right now. I'm in the final throes of finishing a peer-reviewed paper that we'll be publishing shortly.
Awesome. I'm really excited for more vets to learn about this, because we have so many people that come to us that they just have questions and they want some guidance and support. And that's also kind of what the Feed Real Summit is about. We want to make it easier to understand some of these natural concepts, right? Things that people have access to that they can add into their dog's diet or their daily routine to help their dogs live longer. I don't know if you heard, but we recently got the summit approved, race approved for
Oh,
CE
nice.
this
Oh,
year.
that's terrific.
Yeah,
That's
so
great.
we're expecting a healthy mixture of vets,
Mm-hmm.
veterinary technicians, as well as our 2.0 pet parents that are really helping us propel this
Mm-hmm.
movement forward.
I better make sure I get registered, because I'm still a licensed veterinarian, and so those CE credits are very useful.
Yes, and they're
Mhm.
all interactive, which is
Right.
that was a huge feat for us. And thank
Mm-hmm.
you so much to Kay Stewart, who is our head of research and
Mm-hmm.
nutrition, who really helped us get that across the finish line.
Yeah.
So let's talk about all of these things. We're saying from allergy to cancer. I think a lot of people don't like mushrooms. Don't come to mind when they're thinking about a dog that has really itchy skin, right? It's usually elimination diet or maybe even CBD. I think some people might think about. But
Mm-hmm.
I don't think mushrooms is the first thing that comes to mind. How can they help with allergies generally?
Well, there's a couple of ways, and CBD, for instance, there's two recent studies published that show that CBD at proper dosages in many dogs can reduce itching, but it won't affect the actual skin lesions that you see with allergies. With mushrooms, that's a little different. With mushrooms, we have multiple components in that mushroom which can have an effect on the allergic dog or allergic cat. We have these beta-glucans, which are the immune stimulating polysaccharides that are common to all mushrooms. And these beta-glucans help to regulate the immune system. And when we have an allergy, the immune system has gotten the wrong information and it gets overly excited about things that aren't dangerous to the body. And so by helping to achieve more of a balance in the immune system with these beta-glucans, which also have an effect as fiber, as prebiotic fiber for the microbiome. So it helps to regulate the microbiome, which we know has an influence on allergies. And it also helps to regulate the immune system in general. Now, the immune system and the microbiome, one can argue, are very similar, and they are, but but they're also slightly different. So it helps to regulate the immune system. Plus, there's two mushrooms in particular. Reishi, which is the Ganoderma lucidum. That's that big, beautiful mushroom that you can see at the tip of my finger back there. And chaga, which is actually technically not really a mushroom. It's actually the bark of the birch tree that mycelium has grown into, and the birch tree reacts in an exuberant fashion, creating this canker, really, which to many of the ancients looked like cancer, and that was one reason why they started using chaga, because it matched the doctrines of signature for cancer. And lo and behold, so many of these terpenes that we find in the chaga are good for cancer. But some of the terpenes that we find in chaga actually stabilize mast cell membranes in the same way that reishi does. Now, mast cells are the allergy cells in the body that release histamine that create the symptoms of allergies. So it's not an antihistamine in its pharmacology, but it functions like an antihistamine in terms of reducing the release of histamine, which is the big symptom driver when it comes to allergies. So I wouldn't use a mushroom as a standalone. We have so many great approaches to allergies these days through integrative medicine that so many health coaches and holistic veterinarians are talking about in terms of improving the microbiome, using probiotics and whatnot, in terms of the using homeopathy homeopathy and using herbal therapies and looking at elimination diets and all the different approaches that we have. This is just one more addition to our, our protocol for allergies.
Sure,
And
our toolbox.
and mushrooms aren't like drugs. They really are superfoods, and so you're not going to get an immediate response to them. I mean, you might get something, but it's not as good as you're going to get when you're taking it regularly every day for weeks and weeks and weeks. I call it a lifestyle medicine. It's really something that needs to be incorporated into your lifestyle, just like good food. And in fact, mushrooms are good food. They're great food. They're high in protein, very good quality protein. They're high in fiber, good quality fiber, but low in carbs and low in fats. So they fit into almost any diet, the ketogenic, Paleolithic, Mediterranean, or just a basic high protein diet. So they're good stuff.
Yeah. I'm gonna digress a little bit here
because I just digress.
We're gonna go even further because
Okay.
it's what I love to do, and I'm such a nerd. I go into these lives like, wanting to talk about product and everything, and then someone mentions something that I have a million questions about. And likewise for you guys in the audience, if you have a question about the very complex but put in a simple way, the information that Dr. Rowe just mentioned, please mention them in the comments. Send those questions, as we have several from Instagram that I'm going to pull up here shortly. So you said chaga is not the fruiting body like other mushrooms, and you mentioned mycelium, and I think there's a lot of confusion rather
Right.
about mycelium. Can you talk a little bit about that?
Yeah.
Is just generally, and what dog
Yeah.
owners should know?
I think it's really important to talk about it because I think there's confusion amongst the consumers because there's two different types of companies in terms of their fungal production, and both claim to be creating mushrooms, but they're actually creating entirely different products. And one of the products is an authentic mushroom, like the fruiting body of this golden oyster. Let's say that's a real mushroom. But the other type of product is mycelium that is growing on grain. And the problem with the mycelium growing on grain is that most of that product comes from grain. And it's got beta-glucans from grain, but also a lot of starch from grain, and a very small percentage of beta-glucans. Now, the beta-glucans are still good. They're still good beta-glucans. And there probably are some other a few other secondary metabolites, but not very many based on the studies that are out there. So that's where people are thinking that we're saying mycelium is bad when we're talking about mushrooms, and there's some kind of conflict between these two companies. But really, we are an authentic mushroom company, and we just want people to know that what we produce are really mushrooms. Mycelium, on the other hand, is one of the three parts of the fungal life cycle that creates mushrooms, which then create spores. That spores then get dropped and begin to germinate into these little hyphal tubes that then become mycelium. And the mycelium is actually something very powerful. The mycelium elaborates these very strong enzymes, these digestive enzymes that can digest whatever the substrate is that they're growing through and to nourish themselves. And I mean, these enzymes are so strong that they've shown how oyster mushrooms can actually digest chemical waste. Or I've seen one study where they grew oyster mushrooms on dirty baby diapers, and the mushrooms completely consumed the baby diapers and left nothing but edible mushrooms.
No
Although
way.
I wouldn't want to know where they came from, but nonetheless, there was no fecal contamination, no plastic from the baby diapers. The mushrooms are that. So mycelium is very, very powerful. It's a very powerful stage of the fungal life cycle. The mushroom is created by the mycelium. A mushroom is actually organized mycelium. That's why it looks kind of white on the inside. That's the mycelium. And the mushroom's function is to create spores to create the next generation of spores, mycelium, and then ultimately mushrooms. The mycelium, when it grows through that substrate, when environmental conditions become appropriate, usually moister and colder, that's kind of in the fall when we tend to see more mushrooms anyway, then the mycelium says, environmental conditions are correct. I'm going to form a mushroom because it's time to reproduce. And so then the mushroom creates those spores, maybe in the gills or the pores. The reason why mushrooms are up on stalks is so that when the spores drop, the wind can blow them and disseminate them and perpetuate the species. Or that's why mushrooms might be up on trees. Up on trees, you can't see my hand, it's up on the tree, because then when the mushroom drops the spores, the wind disseminates it for a long distance. And that's really the function of the mushroom. But because it has to protect the spores as well as create them and disseminate them, it has secondary metabolites, it has the beta-glucans, it has the full complement of all of these very strong medicinal components that are why we value mushrooms so much and have for thousands of years. But the mycelium is really something pretty cool. For instance, many people have heard about the hemangiosarcoma, the splenic cancer turkey tail study. And the splenic cancer turkey tail study used mycelium. And it was actually an extract of mycelium that was so strong that it was able to slow down the growth of the cancer in some of these dogs in these two studies. So, but the mycelium was grown in liquid culture, not on grain. So you can separate it and you can then apply certain pharmaceutical processing techniques to extract the powerful beta-glucan that it contains. So that's where I think people are confused. There's nothing wrong with mycelium, but when it grows on grain, it gets very, very diluted. So its strength isn't as good. You might have to take a large amount of that myceliated grain in order to get the same effect that you might get from a mushroom, if you even can, because these secondary metabolites like these terpenes and these cordycepins and these nucleoside analogs and all these different components that are in the mushrooms are not in that mycelium grown on grain. So that's what the controversy is. And each part of the mushroom of the fungal life cycle has value.
Sure. Thank you. Thank you for that.
Apparently in China, they prefer to eat the spores of the reishi mushroom. Even though there's not as much research showing its health benefits, that seems to be the preference. They feel that spore contains all that germinal energy that's just waiting to, burst into germination and burst into fungal things.
Interesting. I think the Chinese have the best recipes for mushrooms. I mean, I think for sure, just to consume ourselves. We had, Lee Carroll, who is going to be speaking at this year's summit in October. He was on just a few months ago and giving us all these different ways that we could cook up mushrooms, both for ourselves and for our pets to share.
Yeah.
Okay, I wanted to bring up this.
Lee is awesome. I love that guy.
Yeah. He's a hoot. I can't wait for him to be here in October. So Karen sent in a question. My 14-and-a-half-year-old was diagnosed with dermal HSA and arthritis. What mushrooms do you suggest? She's a pit bull mix, and she beat MCT when she was 9 years old.
Okay. So I think because we do have that study using turkey tail for hemangiosarcoma, although it's probable that other mushrooms would also have similar benefits, I would recommend turkey tail. And historically, turkey tail has been used for cancer because it has the highest percentage of beta-glucans in it, and the most not just a lot of beta-glucans, but a lot of different types of beta-glucans. And so the different types of beta-glucans all kind of impact the immune system differently, giving it this totally synergistic effect. It also has the highest number of terpenes, which are these hydrocarbons found in cannabis and found in mushrooms. When you sniff the cannabis and it smells so good, those are terpenes. That's not the THC. So terpenes provide aroma and flavor to food and fruit. When you squeeze a lemon and it smells like lemon, that's limonene, which is a terpene. So mushrooms have terpenes as well, which cross the blood-brain barrier and have a lot of strong effects. Like when we talk about lion's mane, we'll talk about them again. So I would recommend the turkey tail mushroom for the dermal, which is a skin form of the hemangiosarcoma. And I would use as high a dosage as you can afford and as your dog can tolerate. Starting slow, start with a low dosage and gradually work your way up over a period of weeks. Dermal hemangiosarcoma doesn't tend to be as aggressive as splenic hemangiosarcoma or cardiac hemangiosarcoma, so I think you have a little more time. The arthritis may benefit from the turkey tail. I don't really think of mushrooms as being the first place I go with arthritis, but
Mm,
there is one mushroom in particular that has shown very good benefit for performance and for stamina and to help reduce discomfort, and that's called cordyceps. And cordyceps is also called the caterpillar mushroom because in its wild form, it actually grows on a caterpillar while the caterpillar is pupating in the ground. And it's found wild only on the steppes of Nepal, Bhutan, and Tibet. The wild form of the cordyceps mushroom, but they grow it now on rice, and they could, and not in the rice, but on top of the rice. So when they harvest the fruiting bodies of the cordyceps, they don't harvest the rice with it. So it's just the pure mushroom. But cordyceps is my personal favorite mushroom, and it has a really good benefit. Could have a good benefit for arthritis, but I would look at doing a multimodal approach for arthritis, other things um, than just the cordyceps. For instance, our my new mushroom mobility chews contain three mushrooms. They contain cordyceps, reishi, and golden oyster, which all have different benefits to the arthritic patient. But it also has green-lipped mussel in it, which is good to provide all those glycosaminoglycans, like the glucosamine-like compounds. And it also has boswellia, which is an Ayurvedic herb that helps to reduce inflammation, and MSM, which is a strong source of sulfur and also has some anti-inflammatory properties. So I had to put more stuff in there than just mushrooms because I don't think mushrooms are enough for arthritis. Arthritis can get pretty tough, even such that using strong drugs isn't enough to really um, reduce the discomfort or the pain. My
sure.
favorite approach to arthritis is the injections of Adequan, which is a liquid form of glucosamine that works the best for dogs and cats and horses.
Yeah, I noticed that you have a section on arthritis and cancer in the book,
I do. Hmm.
which was quite fitting for that question. I was going to say you should get the book and read this.
Yeah, well, I think and that's really why I wrote the book because I really wanted to provide some guidance to the pet parent, kind of in a do-it-yourself and reference context. So one, they could understand what their vet was telling them when they went in there, because vets oftentimes talk really fast because they have to run that 8-minute mile, just like MDs do. But also, so they could see not just what the vet was telling them and what the vet recommended, but what things we could add to what the vet recommended. I'm not against conventional medicine. I think you really need to have the best of both worlds to have the best outcomes with many kinds of conditions, especially chronic conditions that can be quite painful. I think you need to think about the patient and their suffering. And
Sure.
even though your agenda may be to stay natural, we need to do something to not allow them to suffer. And sometimes that means you might have to bite the bullet with a pharmaceutical.
Sure. Yeah. No, it makes sense. You got to do
Mm.
what works. Nikita has a good question here. She says, I have a 14-year-old Staffordshire Bull Terrier with a splenic tumor diagnosed in
Mm-hmm.
November of
Okay, good.
last year. 3 centimeters shrunk to 1, feeding turkey tail, reishi, lion's mane, cordyceps, but now has grown back. Any ideas how she can help him further?
Well, I guess I would look at the dosages you're using and maybe play with those a little bit. There are some Chinese herbs which can be helpful for cancer as well. Might be worthwhile trying those. Um, and 14, I understand your reluctance to remove that spleen. Um, but there are some facilities that can do it really quickly with a minimal amount of anesthetic trauma. As long the biggest concern we have with that tumor is that it would rupture and then would seed the rest of the abdomen, and that really makes for a big problem. But I guess the first thing to do would be to work with dosages and maybe add on the Chinese herbs.
Okay. I want to go back to your book a little bit. By the way, Rob is going to be doing a book signing at the
I will
summit
be.
this October. So
I will.
if you guys haven't got your tickets yet, we do have a few left, and it's going to be bigger and better than ever. Every year I try to do it up and at least improve in a couple areas. And you guys said you wanted more people there and you wanted more stars. So we are bringing them. We're bringing them to you. One thing I wanted to ask you about, Dr. Rob, is in your book, you use like a case-based approach.
Yes.
Can you walk us through one of those cases and how you chose your protocol?
Yeah, I will. And I guess what I'd like to walk you through is the most recent case, which is the one with splenic hemangiosarcoma, which we've just kind of been talking about a bit. Although I'm certainly happy to talk about another one. Um, but the Grover, the dog in the splenic hemangiosarcoma case, um, came to me as a friend of a friend to help with, because I'm really not in active practice these days, but I did this fairly recently. Turned out the owner of Grover was a published author, and so he's been really big in terms of kind of cracking the whip and getting me kind of mentoring me to get this book published too, which is kind of cool. And he wrote the preface in the book, and he's an ethnobotanist. He spent 20 years with indigenous people in the Amazon. He's president of the Amazon conservation team with the Smithsonian. But anyway, Grover presented with sudden collapse, which is how we oftentimes see dogs with that. And he went to another vet at Banfield who, with an ultrasound, diagnosed it as hemangiosarcoma, and they told him that the dog had maybe 2 months to live. But they wanted them to do the surgery to remove the spleen. Well, they frightened them so much about the short potential lifespan that Grover would have with this splenic tumor that they decided they didn't want to do the surgery. So what's the point in doing a surgery if in 2 months the sutures are barely healed and the dog is toast? So I normally have never really not taken the spleen out from a dog that I've treated for this condition. It's just kind of the standard of care. But I understood where they were coming from, and I really believe strongly in supporting the pet parent in wherever they are. You treat the dog in front of you, but you also treat the pet parent in front of you. So we agreed to do that, and I put the dog on a protocol of turkey tail. They were able to afford to buy the turkey tail that was from the mycelial extract, but I also had them give the turkey tail fruiting body extract from real mushrooms, and I had them give it at a very high dosage. When you look at the study for the hemangiosarcoma with the PSP, which is the mycelial extract, the first study they did was what's called a phase one study where they tried to find what dosage worked the best. And what they found, they did 25 milligrams, 50 milligrams, and 100 milligrams. And what they found was that with each increase in dosage, they got a better response, but they stopped at 100 milligrams. And so I think that we would have gotten better success with the second study, which they did in 100 dogs with the 100 milligrams, if they'd gone to 200 milligrams, if they'd gone to a higher dosage. So that's why I promote as high a dosage as you can with the mushrooms, as much as you can afford and as much as the dog can tolerate, starting with a small amount and like each week kind of escalating it a little bit to build it up gradually for the dog. Now, turkey tail, the mushroom, I don't think it's great tasting. I think it's a little sour, a little bitter, but some dogs will take it as a powder. And Real Mushrooms has it in a pouch, and we have it in two sizes of capsules, a larger capsule and a smaller capsule. So there's a number of accommodations to that. Um, but in most cases, I think the capsules are more applicable once you get to the higher dosages. So we did that, and then we also added on these Chinese herbal formulas for cancer, for hemangiosarcoma in particular. There's one called the modified Shui Wu Zhiyutang formula that I offer on my website. And then also there's a formula that stops bleeding called Yunnan Baiyao. And we used to use Yunnan Baiyao because it stopped the bleeding, which was, of course, good for a tumor that's in the belly that's bleeding. But as we used it more and more, we have found anecdotally that it actually helps to extend the lifespan of these dogs with hemangiosarcoma. So it's not just about the bleeding. Even after the spleen comes out and we don't have that risk of bleeding, we continue with that as well. And then there was another product called Wei Qi Booster from the Jingtong Qi Institute that also is very good for that. And so that was basically what we did. We did a ketogenic diet, and I also put together a 1-to-1 THC CBD tincture for the dog because that's been shown to be the most anti-neoplastic of all of CBD alone is not as good as CBD with THC. Of course, that brings in a whole nother issue of legality, but also also dogs are super sensitive to THC. And so we had to make sure that we started it gradually, slowly, so he wouldn't have an adverse reaction. And then once they get adapted to it, they can get really pretty high dosages of THC, which we need to get to in order for them to be anti-neoplastic. So Grover did great. He was like running around and having a good time. Now I cautioned them. I said, don't let him run around too much because he's got that tumor in him still bouncing around in there. You could rupture it again. And unfortunately, after 8 months, which is really which is a good period of survival, even with chemotherapy, he wound up running around too much, having too good of a time, and he ruptured that tumor, and that was the end of it for Grover. But that was a success. I think that was successful, and I think that personally, I wish we had removed the spleen, because I think that he could have made it a lot longer without that. But hindsight's 2020. I wanted, I explained to them the reasons, but at the same time, I like to honor the client in their place.
What is life like for a dog without a spleen?
Nothing. There's no big deal. Whatever type of an immune system benefit that the spleen can have in the dog, or as a reservoir for blood, other organs can take up what the spleen does. So it's really not that. It's not like they're losing a vital organ. Certainly they'd be better with the spleen than without, but they wouldn't be good with a spleen that's so cancerous. So it's not going to work anyway.
For future splenic hemangiosarcoma cases, would you first consider removing the spleen, or always treatment first?
I would recommend removing the spleen right away, personally,
Yeah.
because especially, and in this in this dog the spleen had ruptured. Okay, but right after him I treated another dog whose spleen hadn't ruptured, and we did the same thing. But this guy had a lot of money, and so I asked him to do monthly ultrasound so we could kind of track the course of therapy. And at the 3rd month ultrasound, they found that there was a metastasis. Even though the spleen hadn't ruptured and they had removed the spleen, they found a tumor on the liver. And the owner said the vet wants me the oncologist wants to do chemo. What do you think? Well, I thought, well, this guy, they didn't have kids. This was their kid. I said, well, I think if the vet thinks that the chemo is going to help, deal with this, and he can live longer, in combination with everything else we're doing, the diet, the diet and the supplements, the mushrooms and all, go do the chemotherapy. Well, I didn't know that the dog had a heart problem. And the chemo agent, doxorubicin, that they use to treat hemangiosarcoma is cardiotoxic. And I just felt terrible. I didn't know that. And if I had known that, I would have probably suggested that we use some CoQ10 and some carnitine and increase the reishi. Reishi is really good for the heart as well. And then maybe suggest to the oncologist, if they can take the suggestion, that they go a little mild with their levels, that they don't use quite as much as they were using, and use more of a metronomic approach than, a maximum tolerated dosage approach, which is what they used. So
yeah,
I felt badly about that one. You don't always win. You don't win them all. Mm-hmm.
That's true. That's true. You've mentioned a couple times. We're going to jump into our Q&A here shortly. Absolutely. And I'm starting to pull in the questions that we got from Instagram. So for those of you that are joining us live, feel free to drop your questions in the comments. You've mentioned a couple times, when it comes to mushrooms, feed what you can afford or what your dog, the highest dosage that your dog can tolerate. How do we know that our dog is not able to tolerate? What does that look like? What are we looking for?
Diarrhea, vomiting, maybe a change in energy or activity or mentation. I think pet parents are tuned in. I think they can figure that out. But you generally, the worst side effect we see with mushrooms would be maybe soft stools or diarrhea, or sometimes, like with this cat here, for some reason, some mushrooms, even though they aren't known to be, calming in nature, they are. to an animal. Now, in this case, maybe she's not sleepy, maybe she's just relaxed, maybe she feels good.
Mm.
Mushrooms, also can have a kind of a feel good approach to it. Um, Five Defenders contains the reishi, and the reishi does have some calming influence. I have reishi in my relaxed chews. It's used by meditation Zen masters as a meditation aid for centuries because it has a calming effect, a support for the heart, which in Chinese medicine is also the mind. Um, so, but yeah, and likewise with diet. I think that some pet parents and some pet parents feel guilty because they can't afford or don't have the time to feed the absolute gold standard, when it comes to diets. And I think that with diets as well, you just need to feed the best food that your lifestyle, your budget, your time can manage. And sometimes that's not always the best, but it's the best you can do. and
Mhm.
and that's and people need to not compare themselves to other people, but just do the best they can within their own lives.
Absolutely. I couldn't agree with you more. It's hard. Food's getting
Oh,
expensive, not just for our cats and our dogs, but for people.
I know. Yeah, it is tough.
Yeah.
It is
So
tough.
this may be normal for a cat or a dog to be very
Yeah,
relaxed as
yeah. I
a
mean, it's the relaxing part that doesn't worry me. Um, okay.
often I see multiple blends of different mushrooms in powder form. Is it fine to feed multiple at a time? This is maybe something like the Five Defenders that has 5 different mushrooms.
Mhm. There is evidence that there's actually a synergy when you have multiple mushrooms put together in the same product. And in part, this is because they all have beta glucans, but the beta glucans have different shapes and sizes and configurations. They all have terpenes, but likewise, the terpenes are different. So these secondary metabolites can kind of blend together from different mushrooms to improve the outcome for a given patient. I once learned from this one guy that he said he thinks the body is like a lumberyard, and that you just need to keep all the shelves stacked. So when something happens, you've got the tools you need to deal with it. And I think that's sort of my approach also to natural feeding, as compared to commercial feeding, where they're very precise about the amounts of each of those nutrients because it's a commercial product. They have to reproduce it each time. I think those of us that natural feed, I think if we just offer a wide variety of nutrients, the body takes what it needs. Likewise, I think with the mushrooms, I think when we have multiple mushrooms, an individual will take from that what it needs. And so we tend to see better improvement with these multiple mushroom products for a variety of different patients and just using a single mushroom at a time. But both are good. I
Yeah.
think the amount of good is also important. And so I've developed the algorithm for dosing where when you're just dealing with wellness, nothing wrong, like this 4-year-old cat there, then we would use a lower dosage just for wellness. But when you start having problems, like let's say there's mentation and you want to use a lion's mane, or let's say there's an allergy and you want to use a reishi, then you want to use more. And then let's say you got a really tough problem like cancer, or maybe some kind of nasty disease like coccidioidomycosis, some fungal disease. You want to use a lot of mushrooms then. And there's no evidence that feeding a lot of mushrooms has any danger in general. An individual might not tolerate that much, but in general, the population seems to tolerate um, fairly substantial amounts of mushrooms, especially if you work your way up to it gradually.
Sure. No, that makes a lot of sense. This is one more question that I think it was a personal question of mine as well. What mushrooms are best for a senior dog suffering from neurodegenerative condition and Cushing's?
Well, I would recommend for the neurodegenerative condition at least using lion's mane. We have three mushroom extracts that I think are good for neurodegenerative conditions. In general, lion's mane would be one, tremella would be another, and our golden oyster, which is our source of ergothioneine, would be the third. But I'm sure, depending on the nature of the neurodegenerative condition, I'm sure some other mushrooms might have a benefit as well. For Cushing's disease, I recommend the use of cordyceps and or reishi. And that's because cordyceps and reishi are true adaptogens in the mushroom family. And adaptogens have an influence on the pituitary adrenal axis. And so that's how they help to reduce stress. And that's the signature of a true adaptogen, is that they address that particular endocrine axis. But we don't have any um, studies yet in the dog, but I did do a study in the horse, and horses also get Cushing's disease. And
Mm.
there's a slightly different type of Cushing's disease than what the dog gets. But in this study of 8 horses in 2 different barns, we did have very good success using cordyceps for that. Now, Cushing's disease is a tough disease, and it can create some really nasty symptoms. And if the mushroom's not working, I wouldn't depend on it to do that. You might want to look at some of the other approaches that we have to Cushing's disease, which do include a pharmaceutical called trilostane, but also could include, some glandulars and some herbals for that as well.
Thank you for that. I think, unfortunately, as our dogs age, we really want to do everything we can without loading them up with pharmaceutical drugs and really taking the most natural approach. I mean, we see a lot of people avoiding surgeries if they can, and just, trying to make life
If
as
you
comfortable.
can, yeah, absolutely.
Yeah. Well, we're almost out of time here.
Oh,
2 questions that I
sure.
personally had.
Hmm.
I do love all of the mushrooms and real mushrooms 5 defenders. I think there's reishi, shiitake. Maybe I can't remember all of them. I know there's turkey tail in it, chaga. What am I missing?
Maitake.
Maitake. If you could add one more, what would be the 6th defender?
Well, that's a good question. I don't know if you're familiar with the 2 new products that I've just created. One's called Daily Dog, and one's called Functional Feline. One for each of those 2. And I've got 7 mushrooms in each of those, not 6, because I felt that the 5 defenders needs lion's mane, and the 5 defenders needs cordyceps. So both of those have all 7 of those mushrooms in them, as well as herbal adaptogens, live probiotics, detoxicants, like cracked cell chlorella and milk thistle seed, as well as krill meal as a base, which is
Mm.
a great source of phospholipids and marine lipids, and astaxanthin, which is a great antioxidant. So I would say, and the reason there's 7 in there is I couldn't decide. I don't think I couldn't decide which one would be more important to put in there, the lion's mane or the cordyceps. So I just put them all in there.
Yeah.
But and they have such different properties as well. We haven't talked about lion's mane much at all here, but it has some really significant properties, for many of our aging pets as well.
Mhm, mhm. How does one know, how does one choose between the daily dog and the 5 defenders?
Well, I think that the personally, I made the daily dog to be more of a kind of a wellness choice. The
Mm.
5 defenders, I think, could because it contains the 5 defenders in there, but not at levels as high as you could get if you just used the pure 5 defenders. So I think the 5 defenders is probably better to use for more clinical conditions. In particular, the 5 defenders has the reishi and the chaga, so we recommend it for atopy, for allergies, because of that. We recommend it for a lot of things because it is a shotgun approach. It has a lot of positive benefits that have been reported to us by both pet parents and humans who take it. And so it generally makes people pretty happy. The biggest issue with the 5 defenders is it's not as palatable as I'd like it to be. And so
Mhm.
we're looking at creating a powder form of the 5 defenders that will have improved palatability to make it more cost effective, easier to administer, and that the animals will actually accept it and take it.
Sure. Yeah. No, I think that's a great idea. We have to really keep innovating, right? After we get the
Oh,
feedback
absolutely.
from our
Yeah.
customers.
Oh, yeah.
And then my last question for you is, I guess, for dog parents that are new to mushrooms or even cannabis, what are some common misconceptions that you think are important to clear up?
That mushrooms or cannabis are bad for the liver. Not true. Absolutely not true, unless it's a toxic mushroom, or unless you have liver disease to begin with. That you can eat mushrooms raw. You can't. You need to cook them first. There are some mushrooms that actually contain some mildly toxic principles that wind up being destroyed by cooking. But you also need to cook them in order to get the best benefit from them, because you need to break down the sturdy cell wall that has the beta glucans and chitin in it. Um, and that mushrooms can be, that you can take too many mushrooms. I get that question a lot. Am I taking too much?
Mm.
Mushrooms are very, very safe. It's really not a matter of not being safe. It's a matter of whether the individual will tolerate that much of that mushroom, that unique substance that they're taking in there. And also in terms of herb drug or mushroom drug interactions, or CBD and drug interactions, there are very, very few that have been recognized as being so strong that we have to be caution about it. Mushrooms are very compatible with almost every medication, even with chemotherapy. The only thing I recommend caution for would be with anticoagulant therapy. And likewise, CBD, even though we know CBD interferes with some liver detoxification, it doesn't interfere with it enough to really make a clinical difference. So I think that we should worry about other things than those.
Great advice. Thank you. Thank you for that and for sharing all of your knowledge. I'm excited to do a deeper dive into your book. I'm excited to meet you in person, and for all of our attendees of this year's Feed Rail Summit, which is in October 11th and 12th. It's going to be beautiful in October here in sunny San Diego. So I'm excited for them to meet you in person as well. And I can't thank you enough for joining us today.
I can't thank you enough. Thank you for having me. Mhm.
Absolutely. All right, guys. Thank you for joining us. Great questions that you dropped in here. Feel free to catch the replay on YouTube and on Facebook Live. We will be back next week. Yeah. And hopefully we'll see you all at the summit. Take care.
Bye-bye.